Welcome back to another episode of the Weekly Health News. Every week, we bring you the latest news and updates from the world of health and wellness. We cover everything from new medical breakthroughs to healthy lifestyle tips and everything in between. Here's a quick recap of the top news of the week that went by. A new study reveals that listening to your favorite song could make medicines more effective. In another study, it was found that the sound of heavy engines and sirens endured by people who live near busy roads can make their blood pressure rise. A team of researchers from Texas Tech University and Juniata College conducted a study to analyze the impact of walnuts on the gut microbiome to show how it improves your heart health. Another new study found that the first sign of Alzheimer's disease may appear in the eyes. According to researchers, the disease begins in the brain decades before the first symptoms of memory loss. 1 in 10 early deaths could be prevented if everyone engaged in a small amount of daily exercise, such as a brisk 11-minute walk, a large study said. EU released a report stating that cancer-causing chemical compounds called nitrosamines have been detected in a range of everyday foods and could pose a health risk to consumers. India has become the first country in the world to have developed a country-level mathematical model to estimate the prevalence of TB cases. Women with mental illness, neuropsychiatric disability or substance abuse run more than twice the risk of developing cervical cancer, as they are less likely to go for gynecological smear tests, said a study published in the Lancet Public Health. Blood clots in the vein often cause chances of death, and these clots can be avoided with just a mile's walk daily. Children born to mothers who contract COVID-19 during pregnancy may be more likely to develop obesity. Drugs that combat obesity are under consideration for the first time for the World Health Organization's essential medicine list. Walking 8,000 steps, about 6.4 kilometers, 1 or 2 days a week may significantly reduce the risk of an early death, according to a study published in JAMA Journal. In other news, the World Health Organization said it is no longer recommending additional COVID-19 vaccine booster doses for regular, medium-risk adults, saying the benefit was marginal. Before we wrap up this week's health news, it's important to note that COVID cases are on the rise in the country. Please follow COVID guidelines and mask up.